for coming to today's Pet Pawcast. I'm your host, Dr. Roberta Westbrook, and you're here with us at the Campus for All Animals, the Houston SPCA. And I would like to start today's show by introducing you to our Pet of the Week. Our Pet of the Week this week is Mo. Mo is a domestic short-haired cat. He's approximately 1 year old, and he's very, very sweet. He came to us as an injured, unowned pet, and he had a wound on his leg that our veterinary team treated and is all healed. And Mo is now looking for his new home. We encourage you to come on down to our adoption center and meet Mo and all the other animals that we have available for adoption. We would love to be the organization that helps you bring your new family member into your home. Today, our discussion in honor of Mo is going to be about cat vaccinations. As we know, vaccinations are such a huge part of keeping our pets healthy. And sometimes you may be wondering, what are those diseases that the vaccines are preventing? And what are the names of the vaccines that I'm seeing on my paperwork when I go to the veterinarian's office? Today, I'm going to dissect what those vaccinations are for, the diseases, what to look for, and hopefully answer your questions about why they're so important. So if you have questions about vaccines for your cat, hopefully I can answer those today. So let's get started.
Are vaccines equally important for indoor and outdoor cats?
That's a great question. Are vaccines equally important for indoor and outdoor cats? And I would say yes, they are, and maybe even more so for outdoor cats, because outdoor cats are going to be more likely to come into contact with diseases from other outdoor cats, whereas indoor cats have a much more controlled environment. So vaccines are going to be very important from preventing those communicable or infectious diseases to help keep your cat healthy.
Why are vaccines so important for cats?
Vaccines are important to prevent disease. We want our cats to stay healthy and to live long lives. And the best way to do that is actually to prevent those infectious diseases before your cat contracts them, because that can help us to be able to treat them and hopefully cure them. Now, vaccines are not 100% protective. So even if your cat is fully vaccinated, they may not be 100% protective. But what vaccines do is they prevent the severity and the duration of the clinical signs associated with those diseases. So it's still very important to make sure your cats are healthy.
What are the core vaccines versus the non-core vaccines for cats?
So when we're talking about core vaccines, we're talking about those vaccines that the veterinary community feels are necessary for all cats. There are other vaccines that we call non-core that are administered to cats depending on their lifestyle. So core vaccines include one, rabies. Rabies is a communicable disease that can be spread not only animal to animal, but from animals to people, and is a fatal disease. So that's a very important core vaccine that we can talk in more detail about later. And the second core vaccine for cats can be abbreviated one of two ways. Sometimes you maybe heard it called HCP vaccine. And another very common abbreviation is FVRCP. Sometimes people will call this the feline distemper or feline parvo vaccine, but there are two core vaccines. One of them actually will cover multiple diseases, and we will get into that a little later.
How do vets determine which vaccines a cat needs?
Well, a veterinarian can help you determine which vaccines your cat needs, one, by just understanding your lifestyle. So as you mentioned, indoor and outdoor cats have somewhat of a different lifestyle. The indoor cats are going to have a more controlled and likely a clean environment with less disease, whereas outdoor cats are going to come into contact with more unknown viruses and bacteria and other parasites. So it's important that understanding your lifestyle and your pet's lifestyle, that's going to help guide us in terms of what vaccines your cat needs.
Are there any risks associated with vaccinating cats?
There's always risks when we administer vaccines and other medications that are foreign into a pet's body. Typically, when we administer vaccines to cats, they are very healthy and there's not a lot of side effects that occur, but there are potential side effects. those potential side effects are related to vaccine reactions or allergic reactions to the particles in the vaccination. And that can range anywhere from local pain, local swelling and inflammation, all the way to vomiting, lethargy, and collapse. So there are certainly a wide range of potential vaccine reactions. One of those also may even include cancer, localized cancer for certain vaccinations. But it's important to talk about those risks with your veterinarian. And for the first time when your pet is getting those vaccines, your veterinarian will go over the risks and what to look for.
Moving into feline herpes virus, what is FHV1 and how does it affect cats?
Feline herpes virus, or as you abbreviated, FHV1, is a very common virus that causes upper respiratory infections in cats. So when we hear the term herpes virus, we may relate it to a herpes virus that occurs in people, but it's a totally separate type of herpes virus. In cats, the herpes virus causes symptoms related to rhinotracheitis. So herpes virus causes a disease called feline viral rhinotracheitis. Well, rhino means nose, and tracheitis means inflammation of the trachea. So cats that have feline herpes virus, or FHV1, usually have symptoms related to respiratory disease, nasal discharge, sneezing, irritation in the throat. They may also have ocular discharge and ulcers on the eye, and they may even have some difficulty breathing due to nasal congestion. So feline herpes virus is the most common virus that's associated with respiratory disease in cats. And very likely, if you adopted a cat from a shelter or you found a cat outdoors, they've probably already been exposed to herpes virus and could be harboring it. So it's a virus that lasts lifelong in cats, and so it can stay in their body lifelong, but it will regress and it will remain quiet in their body until usually times of stress or other disease, and then the virus will begin to replicate again and you may see respiratory signs. So it's one of those viruses that there's going to be time periods where you don't see anything wrong with your cat, and then during times of stress, changes in the environment, or other disease, you may see signs of that respiratory disease come back up.
How can cat owners manage chronic herpes virus at home?
So the best thing to do if you know that your cat has herpes virus, and we know that this is a chronic virus that lives forever in the body, is to reduce stress and to have regular veterinarian exams. So regular veterinarian exams are going to be at least annual exams where your veterinarian can make sure that your cat continues to stay vaccinated and get heartworm, flea, and tick prevention, and that your veterinarian can catch diseases early. What you can do at home is make sure that you have an environment that reduces stress for cats. So that means making sure that cats have proper nutrition, water available to them, that changes in the environment are limited. Some cats get very stressed when there are changes in the environment, like new people, new animals, moving locations from house to house or apartment to apartment. Cats also like to have places in the home where they can retreat and hide if they need to. So having calm, quiet places for your cat to be able to relax and get away from all of the hustle and bustle is going to be important. Cats also love to climb, and so having cat trees, scratching posts, toys, and similar items around the home can actually help to reduce stress in your cat and hopefully reduce the recrudescence of feline herpes virus.
Moving into feline calicivirus, what is FCV?
Yeah, so FCV, another portion of that core vaccine, is called feline calicivirus. Calicivirus is a virus that also causes respiratory disease in cats. So calicivirus can also cause nasal discharge, ocular discharge, sneezing. One of the keys to calicivirus is that it's more likely to cause oral ulcers. So these are ulcers in the oral cavity that can actually cause your cat to not want to eat, to hypersalivate, and to have pain in the mouth. So when we see a cat that has a combination of respiratory signs and oral ulcers, or ulcers in the mouth or on the tongue, we typically associate that with calicivirus. And this virus can be treated with medications, and it can cause some pretty severe side effects, again, like not eating and weight loss. But this is a very common cause as well of respiratory disease in cats.
Can a cat recover from calicivirus and still spread the virus?
A cat can recover from calicivirus. So both calicivirus and herpes virus are infectious, and they can be transmitted to other cats that come into contact with them. But they will not always shed the virus. So if they're not having active infection, then they're not likely to spread those viruses to other cats. So the key is to, again, keep your cats healthy. And when you notice that they're showing signs of respiratory disease, isolate them and keep them away from any of your other pets. Keep them indoors. And these diseases, both herpes virus and calicivirus, can be treated. Oftentimes they're treated with a combination of antibiotics and anti-inflammatory type medication to make them feel better until the viruses take their course and the cat recovers.
Moving into feline panleucopenia virus, what is it and why is it so dangerous?
Feline panleukopenia is a very interesting disease. So when we talk about the term panleukopenia, what that means in essence is pan means all, leuco means white, and penia means small or low. So panleukopenia is really a reduction of all of the white blood cells in cats. It's an infectious disease that's caused by a parvovirus. So what can happen is a cat will get this parvovirus usually through contact with the feces of a previously infected cat. And the parvovirus can affect the bone marrow in the patient. When the virus gets into the bone marrow, it causes the bone marrow to not be able to produce white blood cells efficiently and effectively. White blood cells, as you know, are very important to fight off disease. So a cat that has a low white blood cell count is not going to be able to fight off disease very easily. And typically these animals will show very serious signs associated with feline panleukopenia that include lethargy, vomiting, diarrhea, sometimes with blood in it, and in worst cases, sudden death. It can be a potentially fatal disease.
Why are kittens the most at risk for panleukopenia?
That's a great question. Why are kittens the most at risk for feline panleukopenia? And the reason is kittens don't have a well-developed immune system, and they may not have a well-developed immune system until they become 17 to 20 weeks of age. So when they're really young, and oftentimes we find a lot of kittens who are born outdoors, they're exposed to this parvovirus out in the community. And because they are not immunocompetent or they don't have strong immune systems, they are more likely to succumb to the parvovirus. The parvovirus loves to live in the gastrointestinal tract. So once the parvovirus gets inside the body, not only does it love to live in the bone marrow to affect the white blood cells, it also loves to live in the gastrointestinal tract, which is why we start to see those signs associated with GI disease like vomiting and bloody diarrhea.
What is the earliest you can vaccinate your kitten against feline panleukopenia?
So the age at which we start vaccinations can vary, and it can vary according to the history of the patient. It can vary according to the product that we're using to provide those vaccines, and we can provide vaccines according to the environment that the cat is going to be in. And so we sometimes here in the shelter will start vaccines as early as 4 weeks of age. Now, this is a very unique vaccination style, and that's because the animals that come to us generally come to us in compromised states where they don't have strong immune systems, and we want to get that immune system going strong as soon as possible. Now, cats that are in more protected environments like your pet at home, we may wait to vaccinate your cat until 6 or even 8 weeks of age, depending on, again, their history and which vaccine product is being used.
Can an unvaccinated adult cat survive panleukopenia?
Yes, it's possible for an unvaccinated adult cat to survive panleukopenia. Even if the adult cat has never been vaccinated, it's very likely that they have come into contact with the parvovirus or virus that causes panleukopenia at some point in their life. And so they may have developed some natural immunity against the disease. And so if they begin to have symptoms like vomiting or diarrhea, and the veterinarian tests them for panleukopenia and that test is positive, certainly treatment can be begun, and it is very likely that those cats will be able to survive. It certainly depends on how severe the symptoms are when they're first caught and how well the cat is going to be able to fight it off on their own.
What are the treatment options for a cat diagnosed with FPV?
Unfortunately, there's no one cure for panleukopenia. It is mostly supportive care. So because we are dealing with a cat that has a very weakened immune system, it's making sure that we can prevent the symptoms from getting worse. So we treat the diarrhea. The diarrhea can be treated with antibiotics, diarrheal medications, IV fluids to keep the hydration status normal, because dehydration in cats with panleukopenia can also contribute to fatalities. So keeping them hydrated, giving them proper nutrition so that their gastrointestinal tract stays healthy are going to be some of the mainstays. Vitamins as well can be added to help keep their gastrointestinal tract very healthy. But essentially, the goal there is going to be to seek veterinary care as early as possible so that we can make sure that we fight the disease with every tool that we have available.
Moving into feline leukemia virus, what is FELV?
So the feline leukemia virus is one of two viruses that we call retroviruses that affect cats. The feline leukemia virus is unfortunately incurable. So if a cat has feline leukemia virus, there's no cure for it. However, it's also a virus that affects the immune system. So leukemia can affect the white blood cell population in cats and also make them more likely to get and succumb to other common diseases. One of the most common diseases that cats with feline leukemia can develop is actually lymphoma, a type of cancer. So feline leukemia is an incurable retrovirus that can be spread cat to cat that affects the immune system.
How is FELV spread among cats?
FELV is spread among cats usually through prolonged casual contact. So it's spread through the saliva, the urine, the feces, or even the milk in a nursing mother. So cats that are grooming each other, sharing litter boxes, sharing water bowls and food bowls can spread this virus from one to another. So we recommend that cats that have leukemia virus are kept separate from those who don't have the virus.
What are the earliest symptoms of FELV?
Leukemia can affect all of the body systems. It can affect the gastrointestinal system, the respiratory system, the neurologic system, and cats that have leukemia virus can have any number of clinical signs ranging from vomiting, diarrhea, lethargy, neurologic signs like ataxia and disorientation, to swellings of the lymph nodes and weight loss. So the signs can vary depending on what body system is most affected at that time by the virus.
How effective is the FELV vaccine, and when should kittens receive it?
So the feline leukemia vaccine, again, no vaccine is 100%, but it certainly can help to prevent the spread of this disease, particularly if you have a cat that's going indoor, outdoor, and you're not certain what cats your cat may be exposed to. The feline leukemia virus vaccine might be one that you consider with your family veterinarian. And it does help to prevent the disease. It may not be 100% protective, but you certainly want to get this vaccine. Usually when you first bring your cat into the veterinarian, you're going to make sure that first your veterinarian tests your cat for the disease. We want to do a blood test to make sure that your cat has been already tested and is negative before we vaccinate. But as long as your cat has tested negative before vaccination, then your veterinarian will make sure that according to the labeled product and the appropriate age that your cat can be vaccinated against leukemia.
Earlier you said that the virus is spread amongst prolonged contact. Are you saying that feline leukemia positive cats can't live with feline leukemia negative cats?
So I would recommend that feline leukemia positive cats should probably be only cat households and not be in direct contact with feline leukemia negative cats. One way to allow for this or to reduce the risk of spread is to make sure that you vaccinate your feline leukemia negative cats. So you want to give them every opportunity to prevent the spread of the disease. So that means not housing them together or making sure that the negative cats have the vaccine so that their immune system can fight off the leukemia virus should they come into contact with it.
Moving into feline immunodeficiency virus, what is FIV?
FIV is a similar virus to feline leukemia in the sense that it also affects the immune system. So FIV, otherwise known as feline immunodeficiency virus, is just like it sounds. It causes the immune system to be deficient in protecting the cat from disease. Now, feline immunodeficiency virus is one that again can be transmitted from cat to cat. The difference between FIV and feline leukemia is that feline immunodeficiency virus, or FIV, is spread through more direct contact, usually through aggression. So FIV is more difficult to spread. It's usually spread through bite wounds and saliva that's penetrating deep. So it's less likely to be spread by the casual contact of cats living in the same home.
Can FIV be spread from mother to kittens?
FIV can be spread from mother to kittens in the milk. And so it's important that if there is a kitten that tests positive for feline immunodeficiency virus, we always recommend retesting that kitten, usually in about 12 weeks, to make sure that anything that has passed from the mom may have been cleared by the kitten's immune system and could actually be a false positive test. So we always want to make sure that in the case of both FIV and feline leukemia virus, that whenever there's a positive test, it's always important to retest several weeks later, usually around 6 to 12 weeks later, to make sure that the cat's immune system has not already cleared that virus and they can go on to actually live healthy lives negative of those two viruses.
What are the early signs of FIV?
So FIV, again, because it's an immunodeficiency virus, it can have any number of clinical signs. One of the things that we notice with FIV is that cats tend to get repetitive illnesses like respiratory disease that just doesn't seem to clear up. So again, that could be sneezing, ocular, nasal discharge, coughing. It could be oral ulcers as well. So cats with immunodeficiency virus will sometimes have bad dental disease where they have really red inflamed gums, a lot of tartar and plaque buildup, and foul breath. And so this could be a sign of immunodeficiency virus.
What kind of special care do FIV positive cats need?
FIV positive cats should see their family veterinarian at least annually. Again, the key here is to keep them healthy and to identify disease early so that we can provide that nutritional and medical support early. So keeping them still updated on all of their vaccines, keeping them indoors in a controlled environment where they don't have exposure to other viruses and bacteria can really help to keep them healthy and live long lives.
Can FIV positive and FIV negative cats live safely together?
You know, FIV positive and LV positive cats, is it possible for them to live safely together in the same home? You know, I would recommend keeping those two populations separate so that you prevent the risk of that disease spreading, and then having a cat with both diseases, which means their body may not be able to handle both of those viruses. But if you're in a situation where you already have these cats that have one or both diseases and they're already living together, then please consult your family veterinarian about how to keep the cats stress-free, to prevent fighting, and to prevent the casual contact that could cause the spread of feline leukemia to your other cats. In the best case scenario, those cats would live separately to prevent the spread of those diseases and to maximize their lifespan.
Do we at the Houston SPCA provide any place to get vaccinations for our pets?
Yes, the Houston SPCA has a pet wellness clinic where you can come speak to our veterinary team about which vaccinations may be best for your pet and what vaccination schedule is going to be best for your pet. We'd be happy to see you and happy to help keep your cat healthy for its lifelong. Thank you so much for joining us on today's Pet Podcast. Again, I'm your host, Dr. Roberta Westbrook. Please come on down to our adoption center. We're open every day from 11 a.m. to 6 p.m. We would love to see you. Thanks again, and we'll see you next week.